Hello, my name is Dr. Adrian Dobrowolski. I am the Bariatric Surgery Weight Loss Program Director here at Hoag Digestive Health Institute. I welcome you to this informational video about our nationally accredited bariatric surgery weight loss program. At Hoag, we consistently strive to set high standards for quality in the complex field of weight management, and it starts with our team of multidisciplinary professionals committed to assisting patients through every step of the weight loss journey. We are dedicated to providing the highest level of patient care and excellence in weight loss surgery recommended by the American College of Surgeons and the American Society for Metabolic and Bariatric Surgery.
And my name is Dr. Katie Blevins. I'm a bariatric surgeon here at Hoag. The purpose of this video is to provide comprehensive and accurate information to people considering or undergoing bariatric surgery, as well as to healthcare professionals and the general public.
At Hoag, we have experienced clinical staff that understands obesity as a complex disease that increases the risk of other health problems. Obesity is defined as a body mass index of 30 or higher and is typically influenced by many factors, including lifestyle, diet choices, environment, metabolism, hormones, and genetics. Severe or class 3 obesity is characterized by a body mass index of 40 or higher, which leads to a greater risk of diseases linked to obesity such as type 2 diabetes, high blood pressure and heart disease, sleep apnea, arthritis, fatty liver disease, high cholesterol, gastroesophageal reflux disease, infertility, and even many types of cancer.
I'm just going to my primary doctor for the first time. He had me run some blood work. With those results, he said that I had a fatty liver. I was pre-diabetic.
Someone like me, I had gone through so many other things before I reached the point of none of this is working. I need something else. I started to have symptoms of other problems that were started to throw off red flags. My blood pressure started to be an issue.
It happened so slowly, and then all of a sudden you look back and you're like, whoa, how did I get here? This isn't going well. I am not in like the same mood that I'm usually in. I'm not waking up excited every day. Things kind of just start adding up, and that's when you decide like you have to do something.
According to the CDC, approximately 42% of U.S. adults are affected by obesity, with an estimated 9% with severe obesity. Obesity and morbid obesity are associated with a higher risk of mortality. Approximately 24.7% of adults living in Orange County are affected by obesity. Some common physical challenges associated with obesity can include walking, climbing stairs, or getting in and out of vehicles.
I was getting where I didn't want to go out. Friends would invite me, and for the most part, I would try to avoid it. My dad had diabetes. He passed from cancer, with weight. Cancer, plays a big thing as well. And so I was like, I knew I needed to do this because it was kind of like a promise to my dad. I know he would be proud of me. I know he would have supported me. I know he would say, do what you need to do. Your health is wealth. And so this kind of helped me get to where I needed to get to for myself and for my family.
There are many weight loss options available to address obesity today. These include improving diet and exercise, lifestyle and behavioral changes, weight loss medications, endoscopic procedures, and surgical procedures. However, even with some of these newer treatment types, surgery remains a gold standard and has the best short and long-term weight loss outcomes.
So since surgery, I've lost 75 pounds, and it's been 9 months. But with that comes not having any clothes. And that's like an emotional feeling too, because the clothes I was wearing were not necessarily clothes that I felt fit my style or clothes that I liked. They were clothes that I felt like I could hide myself with. And now I'm buying things that I enjoy wearing. There are very specific criteria to define if you could be a potential candidate for bariatric surgery at Hoag. These include BMI greater than 30 or greater than 27.5 in Asian descent with an obesity-related health problem, or BMI greater than 35 with or without an obesity-related health problem. These guidelines have been adopted by the American and International Obesity Societies, but some insurance companies have specific criteria for the patients to qualify for surgery. Bariatric surgery can significantly reduce the risk of various obesity-related diseases, which can lead to not only improving one's health, but even curing a patient of their disease. Conditions or contraindications that may prevent someone from having bariatric surgery at Hoag include
adolescents or patients under 18 years of age, BMI below 30 or less than 27.5 in persons of Asian descent, some types of organ failure, patients who are actively smoking, patients with active cancer, and patients who are pregnant or have planned pregnancy within 1 year of surgery.
Bariatric surgery patient journey begins with a thorough initial assessment by one of us, your surgeons. This includes confirming the patient's BMI, reviewing the medical history and overall health, and a thorough explanation of the surgeries we offer and key benefits, potential risks, and expected outcomes. The patient journey is supported by our multidisciplinary team of specialists, including a nurse navigator who serves as a patient advocate, liaison, coach, and educator throughout their weight loss journey. Our team of specialists collaborates with your surgeon to ensure a comprehensive approach to weight loss. This includes referrals to a registered dietitian, neuropsychologist, GI specialist, and, if needed, cardiologist, sleep medicine specialist, and endocrinologist. Our insurance verification specialist also assists you with insurance verification and approval up front, so you can make an informed decision about your weight loss journey and next steps. Bariatric surgery isn't just a procedure, it's a lifelong commitment, requiring ongoing follow-up appointments and nutritional monitoring, which our team helps provide at all stages of the patient journey and beyond. Once you're our patient for life.
And Hoag is wonderful. I would never have wanted to do this anywhere else. The second I filled out the form and submitted it, my nurse navigator, she reached out to me within 24 hours of me filling out like the survey.
So luckily, Hoag was really good at coordinating with my insurance, and they give you a checklist and they say your insurance says you need XYZ, and they give you the paper and they make sure that everything gets done in the amount of time that your insurance says it has to be done in.
I was really grateful because it definitely helped me prepare myself for what I was getting into. It wasn't just a throw you in the pool and figure it out how to swim. Like, no, we started in the shallow end and we just kind of worked our way. And that was definitely something that just appreciative, because I used a lot of the stuff that I learned beforehand and what I'm using now.
Hoag offers a variety of bariatric surgery options for patients, emphasizing minimally invasive laparoscopic or robotic surgery for nearly all bariatric operations with small incisions. The first surgical option is a sleeve gastrectomy, where the surgeon permanently removes approximately 80% of the stomach, leaving the stomach the size and shape of an organic or small banana. Patients can expect to lose 50 to 60% of their excess body weight, which is sustainable over many years. The goal of the operation is to restrict food intake and reduce calorie absorption. Potential risks include leakage of stomach fluids causing infection, bleeding, narrowing of the stomach, blood clots, acid reflux, and potential for nutritional deficiencies. Benefits include removing a portion of the stomach that produces much of the hunger hormone called ghrelin, thereby decreasing hunger and increasing fullness. There's a lower risk of nutritional deficiencies compared to other procedures and is safe and relatively quick as a procedure. The next option is gastric bypass, also known as the Roux-en-Y gastric bypass. It has been performed for over 50 years, and the laparoscopic approach has been refined since 1993. The stomach is divided into a smaller pouch, which is about the size of an egg, and then connected to the small intestine, which is brought up. There are 2 new connections created during this procedure that require healing. Patients can expect to lose approximately 60 to 70% of their excess body weight and keep it off in the long term. Goals of surgery include restricting food intake and reducing calorie absorption. There's a higher risk of complications compared to the gastric sleeve, with additional potential problems of ulcers, dumping syndrome, and intestinal hernias. Benefits of the surgery include decreased hunger because of the smaller egg-sized pouch, which is combined with less absorption of nutrients, as well as other alterations in gut hormones that improve blood sugar levels and feelings of fullness and satiety. Next is a single anastomosis duodenal ileal bypass, also known as the SADY procedure. It combines the benefits of sleeve gastrectomy and gastric bypass. It's a modification of an older known surgery called the duodenal switch that creates a stomach similar to the sleeve with a connection to the intestine called the ileum lower down in the abdomen. Patients can expect to lose 80 to 90% of their excess body weight with this procedure. Goals include reducing food intake and reducing calorie absorption, with risks similar to the overall risk of sleeve and gastric bypass, but with a higher concern for malnutrition. This surgery leads to the most amount of weight loss and improvements in obesity-related health issues, but should only be done in expert hands. The last option is revisional bariatric surgery, which is an adjustment or change of a previous bariatric operation. The outcomes vary depending on the type of revision or removal, but more common ones include removal of a lap band and converting it to a gastric sleeve or bypass, or converting a sleeve to another operation. The goal is to improve obesity outcomes in those who have not been able to achieve meaningful weight loss after the initial operation or fix complications from a prior weight loss procedure. Risks or complications are increased due to scar tissue, as well as longer procedure times, and the risk of malnutrition is also elevated. However, the benefits include improved weight loss in the right patients and can further improve obesity-related health conditions. Alternatives may vary depending on the specific case and will be discussed with you in the clinic.
Choosing which surgery is right for you or your patient is typically selected based on an individual's health and weight loss goals. We, as your surgeons, will support and guide the shared decision-making to find the right fit for you.
Meeting with the Dr. D and his team, that just kind of helped me as I met them more and be able to answer my questions and concerns. It helped me build up that confidence where, like, yes, I'm making the right decision. So it helped kind of ease the nervousness and make me more excited and more confident in my decision and what I was gonna be doing. It just helped me give me the resources that I need to mentally prepare myself for the surgery that I was gonna have.
Like any other surgery, there are general risks associated with surgery. However, bariatric surgery is one of the safest surgeries available, safer than a laparoscopic cholecystectomy. Some risks include dehydration, bleeding that may require a blood transfusion, injury to vital organs, heart attack, stroke, blood clots and pulmonary embolism, leak, fever, shortness of breath and/or pneumonia, excessive abdominal pain, vomiting, infection, readmission to fix a complication, and even death. Let's discuss post-op instructions. Patients are provided with dietary guidelines customized to their needs and preferences and are encouraged to engage in at least 150 minutes of moderate to vigorous aerobic activity per week, along with 2 to 3 sessions of resistance training. Medications that may contribute to weight gain are also reviewed and adjusted with the healthcare team. Patients are prescribed vitamins and supplements to prevent nutritional deficiencies. Regular follow-up visits are required to monitor continual weight loss progress, address any potential issues that arise, and to ensure a patient's general well-being. We also encourage potential and existing patients to join our virtual bariatric surgery support group, designed to be an open forum for sharing information, personal insights, and experiences related to their weight loss journey. Our support group is beneficial for many patients to prepare and equip them for the lifelong behavioral and lifestyle modifications that they will be making in order to lose and maintain their weight long term.
After successful bariatric surgery, individuals can expect weight loss, but more importantly, improvement in obesity-related health conditions with reduced medication use and overall enhanced quality of life. Our experts will foster an environment that promotes healthier eating habits, encourages improvement in lifestyle choices, and supports the patient through their journey while connecting them with others who have either already been through their program or are already in the midst of the weight loss journey.
I initially started at 30 minutes on the treadmill, and I got to the end of 30 minutes, I'm like, I feel like I could keep going.
The biggest part was getting back to the life that I knew I wanted to live and being able to confidently go in that direction again and to wake up happy every day and to be active, to go run.
So I'm down 87 pounds from my initial consult.
When I was at my heaviest, I'd get out of breath just tying my shoe. Now it's just like putting on my shoes, the small things that I'm able to do now.
People have noticed that I've lost weight, and looking at photos of myself from even a year ago, like before I even had the consult, I'm amazed at how different I look now.
It sounds corny, but it's just like, it's freedom. It gave me freedom. It gave me freedom to live my life and to live a life that I wanted, that I've always wanted.
The entire team at Hoag, I felt so comfortable with. I felt so confident in them. Like, I saw it more as like an exciting thing because my life was gonna change. Finally, I was gonna get back to the life that I was living, where I was at my happiest.
Hoag's bariatric program is nationally accredited by the Metabolic and Bariatric Surgery Quality Improvement Program run by the American College of Surgeons. Hoag is ranked high performing in gastroenterology and GI surgery. We have a multidisciplinary team which provides a full spectrum of care. We recognize that weight loss and improving your health require important changes, and we are here to help you make the right choice with you. Thank you so much for taking the time to watch our bariatric surgery patient information video. If you or someone you know is considering bariatric surgery or exploring options for weight management, we encourage you to consult with our qualified healthcare providers.